Sympatholytics, alpha-2 agonists. Alpha-2 receptors are linked with the inhibitory G subunit. This makes a lot of sense because alpha-2 stimulation leads to inhibition to adenylyl cyclase, which means that no cyclic AMP will be produced to activate protein kinase A. When you hear about decreasing CAMP within a cell, you should think about a decrease in cellular responses because protein kinase A is critical in getting things going, like phosphorylating intracellular proteins, receptors, and channels. Without any protein kinase, there is no increase in calcium within the cytosol, and therefore a decrease in catecholamine release from the sympathetic neurons. In general, when I hear alpha-2 receptors, I think about inhibition leading to a decrease of something. For example, stimulation of alpha-2 receptors leads to a decrease in insulin release from beta cells in the pancreas, a decrease of lipolysis in adipocytes, a decrease in aqueous humor production in the ciliary body of the eye, and decreased inhibition within platelets, causing them to aggregate. Guanfacine, clonidine, tizanidine, and alpha-methyl-dopa all act to decrease the activity of the sympathetic nervous system by stimulating alpha-2 receptors on the presynaptic terminal, leading to an inhibition of sympathetic outflow within the CNS. Now, what are some side effects of excessively inhibiting the sympathetic nervous system? Well, the parasympathetic system could potentially dominate the body, leading to CNS depression, bradycardia, respiratory depression, and meiosis. Guanfacine is never used clinically, and clonidine is reserved as a last effort for hypertensive patients that haven't really responded to any other drugs. Tizanidine is used as a muscle relaxant and can be helpful in the treatment of patients with multiple sclerosis and ALS. Do you remember from your neuro chapter what other drugs can be used to treat muscle spasms? That's right, baclofen and cyclobenzaprine. Now, here is probably the most high-yield drug in the sympatholytic class, methyl-dopa. And where are you going to use alpha-methyl-dopa? A pregnant woman with hypertension. And this will be the only time you will ever see it because it has a high-yield side effect of potentially inducing the immune system to produce autoantibodies against red blood cells, causing autoimmune hemolytic anemia. And how would you diagnose autoimmune hemolytic anemia? That's right, a positive direct Coombs test. Remember that a direct Coombs test is performed when you suspect that a patient is producing immunoglobulins against RBC membranes, causing them to be destroyed by the immune system. A great way to test your theory is to wash the patient's RBCs with antibodies that are directed against the general structure of human immunoglobulins. If they are truly present on the patient's RBCs, the anti-human antibodies will cause the blood sample to stick together or agglutinate by forming cross-links between the autoantibodies that are already stuck on the RBC cell membranes. Similarly, the use of alpha-methyl-dopa can also lead to the production of a specific type of autoantibody that can present as a lupus-like syndrome. And what kind of antibody would you test for if you suspect drug-induced lupus? Antihistone antibodies.